Hello everybody. Today's topic and what we're going to discuss would be the Aboriginal Ear Health Program focused on the young people and children in the Aboriginal communities of the NSW. To begin with, I acknowledge the traditional custodians of the land that we are meeting here today. I pay my respects to elders past, present and emerging, and celebrate the diversity of Aboriginal people and their ongoing cultures and connections to the lands and waters of NSW. So, let's move to otitis media. Otitis media is a treatable inflammation or infection in the middle ear that is very commonly seen in children. Most children develop otitis media at earliest once in their 3 years. The early detection and treatment can prevent the condition from becoming more chronic and severe. Frequent or severe episodes can lead to permanent ear damage and hearing loss, affecting learning as well as education and life outcomes. Some children with otitis media feel discomfort or pain, but others show no obvious symptoms. Otitis media is considered to be a major source of ear disease in the Aboriginal children, often beginning with just weeks after birth, recurring frequently and can persist into adolescence. Otitis media can result from a cold, allergy, or respiratory virus or bacteria. If there is a buildup of fluid behind the ear in the middle ear, this may cause earache, swelling, and redness. If a child has hearing loss, it is obvious that their speech may be delayed, which will in turn affect important developmental milestones. Sometimes it can result in lifelong disadvantage by affecting educational achievement and employment. Now, let's look at a few risk factors of otitis media. Malnutrition can make a person more susceptible to infection, and infection also contributes to malnutrition, which causes a vicious cycle. An inadequate dietary intake leads to weight loss, lowered immunity, mucosal damage, invasion by pathogens, and impaired growth and development among children. The second reason being cigarette smoking. Passive cigarette smoking increases the risk of otitis media among Aboriginal children. Recent studies among the Kalgoorlis stated that 64% of Aboriginal children who were exposed to environmental tobacco smoking by their parents had reported otitis media. Another reason would be overcrowding. Overcrowded housing in the Aboriginal communities has been identified as a significant risk factor for otitis media. Within these comes the exposure to campfire and tobacco smoke, which also increase the risk factors for early otitis media in infants. At the same time, breastfeeding could be a major factor. Breastfeeding has a protective effect on the developmental of middle ear disease related to immunological properties of breast milk. Breastfeeding during the first 6 months of the life of an infant can prevent many episodes of otitis media. Let's look at the goals set by the NSW Aboriginal Ear Health Program. They aimed at reducing the number of young Aboriginal children being affected by otitis media by reducing lifestyle risk factors amongst parents, carers, and their extended families. It also aimed to improve the level of awareness of ear health amongst the Aboriginal community, health and educational professionals, thereby supporting a preventive approach and improved early identification. It also looked upon improving the effectiveness of services which lessens the impact of otitis media on health and learning outcomes. Now, let's look at how culturally safe this program was for the First Nation people. The First Nation people have endured systematical loss of culture and language, dispossession of traditional lands, and marginalization, yet have also been demonstrated extraordinary resilience to impacts of colonization. Otitis media is classified as a wicked problem in First Nation people. It is an issue of complexity and is particularly challenging to solve among First Nations population owing to social and historical determinants of health such as overcrowding living conditions and low social economical status. Culturally safe health services for First Nation people have emerged to address challenges of discrimination in healthcare setting. The cultural safety is an ongoing process involving reflection of beliefs, biases, and stereotypes, acknowledging and addressing these perceptions with the aim of providing culturally safe care as defined by the patient and wider community. During the initiation of the program, cultural safety was given more importance, which looked into three different areas. First, being culturally respectful healthcare services. It included measures about how healthcare is delivered and whether systems and providers are aware and responsive to Indigenous Australians' cultural perspectives. The second area focused on the patient experience of healthcare. It included measures about Indigenous Australians' experiences of healthcare and is not defined by the caregiver. It was based on a few literature reviews and research of Indigenous Australians' views on cultural safety. The third area looked at the access to healthcare services. It included measures of ways of indirectly assessing cultural safety, though disparities may be due to a range of other factors such as availability or affordability. It related to different levels of the health system, preventive healthcare services, primary healthcare, hospital, and specialist services. Otitis media affects speech and language development, social and cognitive development, and in turn, education and life outcomes. Social determinants such as inadequate crowding and dysfunctional housing, poor health, and lack of employment also contribute to these very high rates of untreated acute chronic infections. Otitis media or any other hearing loss problems are of low priority within these communities. They are unrecognized to the point where an infected ear is seen as normal. And language delay or failing to talk by 4 years of age in children is not a concern. Healthcare services in remote areas and also in urban settings are overwhelmed by management of chronic diseases. Scheduled comprehensive child health checks are literally ignored in the PHC setting, placing unrealistic and unnecessary load on audiology and ENT services. Ear examinations in small babies and children are difficult. Primary healthcare services provide clinical care on a daily basis, needs continuous medical education, support, and appropriate equipment to develop skills in the otitis media diagnosis. Now, let's look at what can be done to have a better result. A comprehensive approach combining prevention, early treatment, and coordinated management is required to reduce the incidence of hearing loss among Indigenous Australians. Primary prevention includes working with families on encouraging breastfeeding, eating a healthy diet, reducing exposure to secondhand smoking, nasal passage clearing, seeking early medical assistance, and encouraging vaccination. When loss is detected, access and referral to a range of health services is needed, including speech therapists and audiology support services. If permanent hearing loss is detected, access and referral to support for hearing augmentation and other remedial therapies should be sought. Working in partnership with local communities and health services is important for building culturally appropriate services and maintaining communities. They help primary care services and health professionals diagnose and manage ear disease or refer children for specialist treatment. This goal to work with communities is to establish reliable, sustainable, and culturally appropriate services that ensure every ear of every child is healthy and hearing every day.